Hi, my name is Phyllis Brown, and I am the face of heart disease. And this is my testimony that I recorded in 2014.
Good
So I'll
morning,
let you take a
everyone.
listen
My
to
name
this,
is
and then I'll be
Phyllis,
back.
and this is my story. Last weekend, I was running a half marathon in Washington, D.C. This weekend, I'm uploading a video just to tell my testimony about the fact that I had a heart attack this week. Yes, that's right. Last week I was running. This week I had a heart attack. The reason that I am posting this video is to let women, men, whomever, to watch for the symptoms. I went in on Wednesday morning after I went to work, and I told the guy who I was working with, I'm going to the emergency room because my chest is killing me. And he says, Phyllis, you really need to go to the doctor. You really need to go to the emergency room because I had problems on my right side, not my left side, like the classic symptoms are, my right side. I had problems breathing. I had a little bit of discomfort in the center of my chest, but it wasn't enough to whereas it was anything that was out of the ordinary. I thought it was just maybe a pull muscle in the right side of my chest because of the fact that it went from here and it felt like someone had, well, most women will know when you get punched in your breast really hard, that's how it felt. Or when you have really, really tender breasts when you're on your cycle, and it was like that times 10. So I was like, well, this is not normal. So, of course, I'm a retired Marine, so I figured I could tough it out for a little bit. But once you start trying to tough stuff out and the tears start coming, your eyes start welling up when you know, it's time to go see what's going on. So, needless to say, I go to the emergency room and they do some tests, and lo and behold, it comes back when they did some blood test that I had some high enzyme levels. And the enzyme levels, or they check your troponin levels, which means that you have damage to your heart. So fast forward a couple of hours, I go to Portsmouth Naval Hospital, and then he says, well, your levels are still high. So what does that mean? That means that you have some type of heart damage. Had a very wonderful doctor, Dr. Lenz, and she was telling me all the things that could happen, that maybe could happen because of the fact that next morning I was scheduled to go in to have um, to the cath lab, which means it's a catheterization lab, whereas they go in, and with me, they just went in with a little spot. I'm not really sure if you can see it, probably because of the fact that it is so small. It looks like a mole right there, right there. That's it. That's where they went in into the artery on my wrist, and then they checked. They put some fluid in. First, they put some dye in your arm, and then they checked for blockages. They found four blockages. Yeah, that's right. They found four blockages, and in my heart. And they says, well, pretty much she had told me that once they go in and they find blockages, they're going to put the stents in right there. They're not just going to say, hey, Phyllis, we're going to give you, come out and say, hey, do you want to do this? And I was like, no, since you're already in there, go ahead and do it. So they put two stents in, which means a stent is just they just go in with like a tube. It's a really small tube, and then they blow the tube up, and the stent is like a mesh tube that opens up your arteries. So they found two that they could actually open up, and then there was two that were at the bottom of my heart that were so small that it would have been a moot point to even try to open those up. But the best part about it, which your body is miraculous, is that although those were blocked, my body had already created another artery to go around that area that was blocked. So that's what God made your body for. Our body, there's no doctor that can tell you that they can do anything better than what God can do. The body was created by God anyway. But uh, the artery that was blocked in my heart was in the front part of my heart, which was called the left anterior descending artery. And if you look that up, it's called the widowmaker artery. So yes, I am completely blessed because that's the artery that if it's blocked completely, that's where you have one and done. So anyway, God hasn't finished with me yet. So that was one of the reasons why I am doing this video. I was a little reluctant to do the video, but I was like, you know what, God, I guess you just, I've been praying on what am I supposed to be doing in this world. Sometimes God has a way of slowing you down so that you can get what you are supposed to be doing out. So I am putting this out to all of the women out there that if you're having some issues, and if you think you're having some issues with your heart, like for instance, like having a whole bunch of heartburn, that you're not really sure of why, and you haven't eaten any spicy food or any food that disagree with you, go into the emergency room. Just go in, even just to have your doctor check your enzyme levels in your heart, because it was a simple blood test that found that I had some heart damage. It was a simple blood test. I had no typical symptoms of a heart attack because everything was on my right side. And when I was telling them, I said, I have some issues with my right side, not my left side. Wasn't down my arm. I didn't have anything on my left side, but women have atypical symptoms. As I was talking with some of the doctors and some of the residents at the hospital, they were saying, there could be 15 women who come in with heart issues, and there could be 15 different symptoms. So if you're not sure, ask your doctor to do some tests for you. It's a troponin test. It's a heart enzyme test. Have them check it. If they're going to do the blood work, have them check that anyway. You don't want to do one and done. My mom had a heart attack at 56. Anytime that you have a history of coronary heart disease in your family, have them check. Not only did my mom have heart disease, my son at 29 had a blocked artery. He had his in the back of his heart. So here's my mom, here's my son, I'm in the middle. Guess what? I was thinking it could have passed by me, but it didn't. So, but if you're even have the slightest inkling of thinking you've got some heart issues, have your doctor check it out. And if you don't have your doctor check it out, just go to the emergency room and just tell them you having heart issues. And one thing about it, if you go to any emergency room and you're telling them that you're having chest pains, it's a do not pass go, and they take you right back. And they will do the troponin levels, the heart enzyme the heart enzyme levels. But just have them check it out. You don't want them to find out after you've had so many issues. You would want to have a little spot like this on your wrist. You don't want to have them crack your whole chest open, because my next step would have been, if they couldn't have put stents in my heart, would have been an open heart surgery for complete bypass. And instead of a week off work that I'm having to take off now, it would be 6 weeks off work because of the fact that your chest would have been cracked open. So anyway, that's my message. Please, 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 ladies, heart disease is killing us left and right. Also, our men, we got to take care of them too. Our men and our young, not only our old men, but young men are dying too with heart disease. With our diets now that are just off the wall, that we got to take care of ourselves. We got to start taking our health into consideration right now, because the fact that we're going to lose a generation of people, of young people, because of the fact that heart disease is a disease that's affecting our kids at a younger and younger age. So if we can do a little bit, that's going to be good. So pass this video on. Look up at the National Institute of Blood and Health. Look up that information about heart disease, and we're going to start getting the word out. We're going to start getting the word out. We have to, because of the fact that nobody else is going to take care of us except for ourselves.
So fast forward, this is February 2016, and I'm here and I'm healthy in mind, body, and spirit. And I pray that if you have seen the entire testimony, I pray that you don't take it for granted, that you take care of yourself. And I pray blessings upon your life and upon those who you have in contact with. I thank you. Bye.